Leigh, I'd like to thank you for taking some time to come in to talk to us this morning. And I just have a couple questions for you. How did you hear about me?
I heard about you through my dentist, Dr. Lockman, and I'm doing work with my jaw, and he recommended that I come and see you about the rest of my spine, and yeah.
Just to fill the people in that are watching, I'm going to let them know that that when people are having the bite reconstructed, one of the first things that need to be done is to make sure that the neck is in proper alignment so that the jaw closes properly. This way the dentist can correct the bite the way it should be and not end up creating a problem in the neck.
Right.
So this, we see a lot of people come from dentists, and we're really happy to help them, and they tend to be wonderful patients, so we're happy about that. What were things like before you came to see me?
Oh, I was just in constant pain. Through my back, down my legs, I had sciatic. It was just constant pain. You know, there were days where I didn't know how I'd even get through the day. And I remember you saying to me, "Oh, yes, I can help you." And my response was, "Well, we'll see."
A little bit of disbelief, was it?
Yeah, I was a little skeptical because I'd tried so many things before, and yeah.
What kind of things had you tried?
Well, I tried just regular chiropractic. I tried, I'd done a lot of prolotherapy, PRP, which is platelet-rich plasma therapy. I have done massage. I've done Reiki. I've done reflex. I mean, you know, you name it. I've just tried everything. Yeah.
Well, those treatments you mentioned, you know, those are like some serious last-ditch efforts that a lot of people make to try and solve their problems, and they're not inexpensive.
No, they're not.
And so then we started with the NUCCA care here, and can you tell me what's better? How's your life better?
Oh, I just, you know, I am virtually pain-free, and you know, I'm able to do things I haven't been able to do for years. Like, you know, this spring I'm so enjoying my yard and my garden because I can get out there and I can bend and move around. You know, my muscles might get a little tight, but, you know, I don't get in that same pain that I had before.
Well, that sounds like a big improvement already.
It's huge, yeah.
Now, there was something else that you found was a benefit that you weren't initially expecting or thought was connected to your spine.
Which is my digestion?
Yes. So tell us a little bit more about that.
Well, I've had digestive issues for years, and all of a sudden they just settled down. I'm able to eat foods I haven't been able to eat. And then now I know when my digestion goes off that I need to come in for an adjustment. Like the two they're just linked. They're, yeah. Nicely correlated. Very correlated, yeah.
And just for the people that are viewing, I just want them to know that the same controller that looks after balancing our posture is also responsible for regulating our digestion, our mood, our sleep, our blood pressure, our immune system, the pressures of the fluid inside the skull, and then of course the balancing the posture.
Yeah.
So anytime we have disturbance in any one of these areas, we can actually look at the postural control to see if that's the regulation is out of whack, basically. And so that's really great that you noticed that. And I've heard you say that when you come in the office, I think I need an adjustment. My digestion is not right.
That's right. And that's how I can tell now, is I know if I'm not digesting properly, I need to come and get an adjustment. Yeah.
Well, I'm happy that you've had all these benefits, and it sounds like it's really life-changing for you.
Yes.
And once again, thanks a lot for coming in and talking to us today.
Well, it's been my pleasure. I think you've given me my life back. Thank you.
I appreciate hearing that. That's why I do this work. So,
Yeah.
okay.
Yeah.